to thank you guys for coming. I'm going to talk to you a little bit about breast cancer. At the end of this, my hope is that you all have learned something. Hopefully you will learn what breast cancer is, how you can detect it, and some of the statistics about it. Many of you may already know what cancer is, but for those of you who don't, I'll try and explain it as simply as I can. There are many types of cells in our bodies. They all are easily distinguished from each other. We have blood cells, skin cells, brain cells, liver cells, and they all have specific purposes in the body. Healthy cells divide in an orderly fashion when our bodies need more cells, and abnormal cells divide without any control or order, and when this happens, they form excess of tissue, and that is called a mass or a lump, which then we call a tumor. Tumors can either be benign or malignant. Benign means that it is non-cancerous, which means that it doesn't travel outside of its area where it began. And malignant means that it is cancer, and it can travel and spread to other areas in the body. That's when the out-of-control cells divide and become undifferentiated, which means they've lost their distinguishing characteristics of the original tissue. This type of tumor is one that you would have to go and get treatment for because they do consider it to be cancer. Another term that's important to know is metastasis, which means the spreading of cancer. One thing you might want to know is, can you survive breast cancer? And the answer is yes. Although breast cancer is a scary disease, it does not issue a death sentence, and you can survive it, but the key is to detect it early and get treatment, which hopefully this will inspire you to do that. There are over 2 million breast cancer survivors currently living in the United States, which just shows you how easy it is to overcome the disease if you get treatment when you need to. In 2001, roughly 182,000 new cases were diagnosed. Breast cancer is the most common type of cancer among women, but it's also the easiest to screen for, detect, and to treat. An average woman's lifetime chance of getting breast cancer is 1 in 8. That's without any additional risk factors. There are many risk factors, some of them that you can control, which is poor diet, smoking, drinking alcohol, lack of exercise, being overweight, things like that. And then there's a lot of them that we can't control, like our race, our family history of cancers, family history of diseases, how old you are when you had your first period, how old you are when you have children, how old you are when you get to menopause. And the reason for that is because the more periods you have in your lifetime, the more at risk you are for breast cancer. And that's due to the hormones that are released in your body during those cycles. So the older you are when you hit menopause, or the younger you are when you have your periods, the more at risk you're going to be for breast cancer. If you want to find out what your risk factors are, you can go to the National Cancer Institute online, and they offer a risk assessment to help you figure your risk factors for cancer. The best way to detect breast cancer is for women to do self-breast exams, which if you're not sure how to properly perform a self-breast exam, you can go to breastcancer.org, and they give a detailed instructions of how to perform a self-breast exam. 2/3 of all breast cancers are found during self-exams, so that's your best chance for detecting it in an early stage. You know your body better than anyone, so obviously you're going to know if there's something wrong. Women who are over 40 should also have a mammogram once a year, and if you have a lot of those additional risk factors we talked about, then you might also have to have an MRI done yearly in addition to your mammogram. Your doctor will know what's best for you, so you need to talk to him about that. If you ever had cancer or breast cancer and been treated for it, once you're cancer-free, you know that reoccurrences can happen. Most reoccurrences happen 2 to 3 years after surgery or after treatment, and the longer you go without reoccurrence, the better your chances are that you're going to remain cancer-free. It's important to do follow-ups regularly in the beginning, every few weeks, and then every 6 months after that, because you are at a higher risk once you've had cancer. And you're also at a higher risk for other types of cancer once you've had breast cancer, like lung cancer, liver cancer, and skin cancer. So you definitely want to continue your self-breast exams because, again, you know your body better than anyone, and that's going to be your best chance for survival. It'd also be a good time to make some lifestyle changes, eating better, quit smoking, exercise, and talk to people who've been in the same situation, get involved in support groups, educate yourself on cancer and how you can prevent it, things that you can do. And for more information on breast cancer, you can go to your local library. The Komen Foundation has a ton of books you can get, videos to show you how to perform self-exams, And you can also go to the nationalcancerinstitute.org or breastcancer.org. So thank you very much.